Good afternoon. Thank you all for joining us today as we come together in celebration of the Mount St. Joseph University PA Program Class of 2026. My name is Jen Garrett, and I am the Program Director for the PA program. As everyone in the room is well aware, these students started this journey years ago. Potentially, they were a 3-year-old that recognized that their sibling was hurt and needed cared for. Maybe they followed in the footsteps of a family member or a friend who had dedicated their lives to healthcare. Potentially, they witnessed a loved one who suffered, or they suffered themselves, and they committed to pursuing a career that allowed them to impact others through the calling of healthcare. Their stories are each unique and full of motivation and sacrifice, full of dedication and drive, and hopefully full of many laughs and few tears. I am extremely grateful that each of them committed to the pursuit of the PA profession and that pursuit involved time here at the Mount. I would like to welcome our Chief Mission Officer, Joe Shadle, to the front, who will offer an invocation this afternoon.
Thank you, Jen. If you bow your heads with me in prayer. Loving and gracious God, we gather this evening with full hearts, grateful for the journey that has shaped these graduates and hopeful for the healing work that lies ahead of them. Inspired by the founders of Mount St. Joseph University, our own Sisters of Charity of Cincinnati, bless each graduate with a spirit of compassion that sees the dignity in every person they serve. May these students listen deeply, act justly, and bring comfort where there is fear, hope where there is uncertainty, and healing where there is pain. We give thanks for the families, faculty, mentors, and friends who have supported them along the way. As these students step into their vocation, guide them with wisdom, humility, and integrity. We ask this in your holy name. Amen.
I would like to take a moment to introduce and thank a few more key individuals. Unfortunately, not everyone is able to join us today, but for those in attendance, please stand, if able, when I read your name. Dr. H. James Williams, the President of the University. Dr. Stephen Almquist, our Provost. And Dr. Darla Vale, the Dean of the School of Health Sciences. We are extremely grateful for their continuous support of our program and of our students. I also want to recognize the rest of the PA program faculty and staff. This group of individuals with diverse educational backgrounds, life experiences, and personalities makes the program the incredible place that it is. Our founding program director, Patrick Cafferty. Our founding medical director, Dr. Creighton Wright. Clinical Director, Teresa Groh. Academic Director, Megan Pater. Medical Director, Dr. Stephanie Straight. Our Principal Faculty, Corey Ehrenfried. Andy Green. Mara Prickett. Darlene Tierney. And Brooke Wong. Our staff, Lisa Cracciolo. Michelle Reynolds, who is out on maternity leave with beautiful twins. And Sally Shalulo. Our biology colleagues, Dr. Maria Brown, Dr. Heather Evans, and Dr. Beth Murray. And our adjunct instructors, Andrea Brackman, Brian Brem, and Sarah Cohn. Thank you all for your commitment to the program. I would like to next invite Dr. Vale on stage to share her congratulations, and she will also introduce our convocation speaker.
Thank you, Professor Garrett, and good afternoon. So I want to add my congratulations. These last 2+ years have gone by quickly, from my perspective anyway. The days may have been filled with challenges and unknowns, but you remained committed to your goals and showed great dedication to persevere and succeed. That is quite an accomplishment. We recognize you did not do it alone, so I also wanted to thank those who supported you, your family, friends, the faculty, and staff. Every graduating class holds a special place. The faculty, staff, preceptors, and community members have all shared numerous accolades. Your class is described as being extremely hardworking, I heard that a lot, and proactive. I hope you continue to be curious and open to new research and discoveries. Always continue learning and never lose that care and compassion for others. So congratulations again. Stay connected with the Mount, your faculty, and each other. Well, I now have the privilege to introduce our convocation speaker. Dr. Creighton Wright Sr. is a distinguished cardiac, vascular, thoracic surgeon, educator, military leader, and advocate for healthcare education, whose impact on our region and Mount St. Joseph University has truly been transformational. His abbreviated resume spans 34 pages. Dr. Wright has authored more than 200 publications, received numerous honors for teaching, leadership, and humanitarian service, including most recently the Ohio PA Association Charles L. Hudson, MD Award for exemplary service to the physician assistant profession. Throughout his remarkable career, Dr. Wright has served in numerous leadership roles across healthcare, academia, and the military, including Vice President of Medical Affairs at Mercy West Hospital and professor at both the University of Cincinnati and University of Kentucky College of Medicine. A decorated Army colonel, he received the Bronze Star and multiple commendations for his service during Desert Storm. I have had the privilege of knowing Dr. Wright for many years. As a cardiac nurse, I came to know him early in my career, not only as an exceptionally skilled surgeon, but one with the kindest bedside manners that I had ever encountered. As Professor Emeritus at the Mount and founding medical director of the Physician Assistant Program, Dr. Wright has played a pivotal role in establishing and advancing the PA program from its earliest vision into the highly respected program it is today. I could go on, but I won't. So please join me in welcoming Dr. Creighton Wright, Sr. to the podium.
Thank you very much. Can you hear me in the back? My wife accuses me of speaking both too slow and too softly, so I will try to be heard. I'm particularly excited to be here. It's always a delight when I'm with President Williams, Provost Almquist, and Dean Vale. They're just amazing people, and it's been a great pleasure to be with them. So when I was asked to do this, of course, some months ago, it always sounds easy till you get here. But I have thought about it a lot, and I appreciate the invitation to speak. So organizing for the event, I decided to use an old approach: who, where, why, what, and when. Starting with who, and we've mentioned some with President Williams and Provost Almquist and others, and our honoree is here as well. But I wanted our class of Mount St. Joe's PA program, of whom I'm exceptionally proud personally, to stand. Please stand for me. Turn around and thank the people that really got you here. Thank you very much. Class of 2026 has really been amazing to me. And so that part is the who. Now where? We should take a minute. We're in one of the more beautiful places in all of Cincinnati, the Mater Dei Chapel, Mother of God, again, as we were for your white coat ceremony. And I hope many of the families were here as well. And there is a brochure about it I noticed in the back. The name was inspired by the words of Pope John the 23rd, just 2 months before the chapel's dedication. There is also a note, a plaque in the hall marking the designation of the chapel as a National Historic Place. So you're here as part of a historic event in a historic place. The artwork, as you look around, is also done by Sister Augusta Zimmer, an internationally known artist, and her art students. So that's the where, and it is a beautiful place. Please look around and enjoy. Now, why? As Professor Garrett said, 27 months ago, these young people began a very challenging program to arrive at this moment and obtain their degrees, and they are here to do that. We told them during their application interviews they would be drinking from a fire hose with all the new academic and clinical material to learn. And that certainly is true, and I'm sure they have told you that. The second why me, and what am I expected to do? Perhaps make it a memory for you, hopefully meaningful or inspiring, and hopefully practical for the students. I am to give the graduates a message. In keeping with modern academics, I did look at ChatGPT. I did not use it, but I did look at it. So I'll stick to my own outline. So briefly, as Patrick and Mr. Kafke and I know, I have some history with the PA program. As the dean said, in 1961, Charles L. Hudson from Cleveland, Ohio, and Case Western proposed at an AMA meeting and published about creating a physician assistant program to contend with shortages of caregivers. And he continues to be honored for this insight by the Ohio PA Association. In 1965, for similar reasons of need, the first actual program was started by Dr. Eugene Anson Stead, professor and chair of medicine at Duke. And the first students in the Duke program were Navy corpsmen after some wartime experience and health experience. Dr. Stead was a giant of the time as a leader, scientist, and teacher. He was an amazing clinician, and the Osler Ward at Duke was his domain where he cared for underserved patients. He was born on October 6, 1908, and you'll know the annual PA week starts on his birthday. For your local interest, he had been a resident at Cincinnati General, now the UC Medical Center, in 1935 and 36. Why do I bring him up? I was his student and intern in my decade at Duke. I may be one of the only few that you ever meet who knew him personally and worked for him. He taught me history taking and physical exam, and I and we as students presented our cases on Osler Ward bedside to Dr. Stead. Very challenging. And there are lots of additional stories could be told about that. He did offer me a position in the Duke Medicine residency program after that, but I thought I wanted to be a surgeon. Nevertheless, Dr. Stead arranged for me to have a medicine internship in cardiology and hematology with two of his favorite graduates. I also happened to find my wife, Carolyn, at that hospital during that internship. I was very lucky to have him become my mentor at Duke, and I remain aware of his presence when I teach or see patients. In many ways, Dr. Stead changed my life and my trajectory, and that is my why of being here with the Mount PA program. Mount St. Joseph leadership and board started discussing a PA program in about 2014 or 15. Dean Vale invited me to join them, and I felt that Dr. Stead was looking down on me and giving me advice to be part of the program. Dean Vale and Professor Cafferty gathered the resources, engaged the talented faculty, and graduated the inaugural class in 2020. You can see what a great job they have done. So that's a brief history. So that's who and where, now what. To this current group of graduating PA students, I could talk about a lot of things. I could talk about the 3 C's, all essential and always in the curriculum. As Joe said, care, compassion, communication. Compassionomics has become a new term and classes created in caring and compassion. All are critically important and do overlap with the 3 A's. I've consistently used the 3 A's for guiding general success in life and success in medicine. These will be important to your next steps in your wonderful careers. So I will repeat and emphasize 3 A's: availability, affability, and ability. Let me focus on them in medical care, our world. Availability: answer the person, answer the phone, answer the email, answer the text quickly, or have someone do it. Have a person do it. Be responsive. You, as I, may hate 1-800-NEVER-ANSWER. I certainly hate the push 1 to make an appointment. Some of the other things that are current in the world. And so does everyone else hate those. Your colleagues want answers, your patients want answers, your family want answers. To them, their situation is urgent. Answer them. I'll give a personal example. A couple of years ago, I needed some knee surgery. I know most of the orthopedists in greater Cincinnati. Decided to call a couple of them. The first one answered immediately. The other one had a staff person call me back in several days. Guess who did my surgery? If you want to have a practice, build a practice, respond, be available. Our undergraduate, Katie Byrne, works with Dr. Michael Greiwe, and when I called her, she also got my wife, Carolyn, in for a shoulder replacement. So we do count on you, PA students and graduates, to help us as you move forward in your careers. Be available means be present when with a patient. Stop, look, and listen. We health professionals are accused of giving about 15 to 17 seconds of listening before we start talking. Probably true for many. Then they're looking at the computer and never touching the patient. Here at the Mount, you've been taught better. Stop, look, listen, examine. You know this, particularly if you've ever been a patient. Put yourself in their shoes or gown or whatever. And that is why availability is important. You are to be engaged. Affability. Mama's here, Mama told you. Always be nice to everyone, all levels of persons. Hospitals need everyone to do their job, and so do offices to be successful. Over the years, I've done a large number of interviews for jobs, for residents, for PA students, for med students. Some of the interviewees were arrogant or unpleasant to Jackie. You don't know Jackie, but she was my very pleasant, petite, kind staff assistant. People behaved in haughty, arrogant, demanding, demeaning, or rude behaviors around her or with her. They did not get the job. Jackie was an integral and critical part of the evaluation process. I counted on her to tell me who I should not take. Similarly, nurses know the patients. Listen to them. They may save the patient for you, or they may save your posterior anatomy. Your posterior anatomic. You are highly educated, and they are too, and experienced, and there for hours with the patients. I'll use an example. At 2 a.m., if I was getting frustrated or frosty on a call from a ward or a nursing unit, my wife, Carolyn, the nurse, would recognize that, and I would get a sharp elbow to my side. Just be your best. They are just trying to help. Usually I had not asked the right question, so I suggest that you ask the right question. SBAR is the Structured Communication Framework: situation, background, assessment, recommendation. Originally from the military, but now in medicine, it enhances communication between professionals and enhances patient safety. SBAR. So some more my alphabet. I did learn as cell phones became available when I had one of those calls in the night. My next move was to be at the bedside talking to that nurse on my cell phone. That did make a reputation for me, as was noted, as a caring and responsive provider. Debbie Hayes, a critical care nurse during those days, is now the CEO at Christ, still tells stories about me coming there in the middle of the night with my cell phone. Next of the 3 A's is ability. You have gained huge knowledge base over 27 months, but you're now engaged in a lifelong learning profession. Change happens. Be prepared. I still can teach anatomy, but I couldn't touch a class in pharmacology. I've been learning for over 60 years, and it's such fun to see and do and learn. Every patient is a textbook, so be open to interact, study, and understand them. And many will become friends and neighbors and your supporters too. I'll give a sidebar example. I still get oranges and a thank you note every year on the surgical anniversary of an ophthalmologist here in town that I did 6 bypasses on in 1995, 31 years ago. So he still writes me and sends me notes or calls me these many years later. You may have heard another of our patient families is starting a scholarship here at Mount St. Joe for PA students. Good people, good example, good patients, long-term friends. A critical element of your ability is to learn to care for so many. Classically, I do believe the harder you work, the luckier you get. And you have worked, as noted, very hard. Our professional lives are fun. Medicine is fun. Surgery is fun. Enjoy it. I do envy you as you begin this next phase. So exciting. We get to see amazing people and enjoy such amazing relationships. I'll go back to Dr. Stead for a minute. He was well known for his aphorisms, his wise sayings. Dr. Osler had done that at Hopkins earlier on. So an aphorism. Learning is an active process, and each of us learns more when we teach than when we were taught. Thank you from the faculty. Thank you, class of 2026. Another of his aphorisms, the effectiveness of the teacher must be judged by the things which happen after the student and teacher part company. Let's see how we did. It's your turn. We will be watching you. When you graduate, which is very soon, and key to you and your colleagues, there is one additional to the 3 A's. It was mentioned earlier. Integrity. Integrity. We count on you for your integrity. You say you will do it, do it. If you say you will check the lab work, do it. If you said you looked at the x-ray, did it. If you said you would call back, do it. Dr. Stead always gave us tasks, and we did them without hesitation. So now your next task, and I understand you're ready for it, after today is to still focus and study hard. To take your pants, or the others in the audience, that's your PA National Certifying Exam, and keep going with your pants very seriously until you pass it on the first try. Just do it. So finally, to my organized talk, finally, you are highly selected to be at the Mount. Now you've completed the requirements. It is your turn to pass it on and become mentors as you proceed and succeed as PAs. As you know, you're entering one of U.S. News and World Report's top careers for 2026 and beyond, and your when is now. Congratulations and best wishes for you and your amazing careers. And remember, we want to know who, where, what, why, and how you're doing. And I think Sally has a barcode for you to sign up so we can stay with you as well. We all here on the faculty are proud of you, class of 2026. I am personally very proud to know all of you and have very high expectations for you, and very much appreciate this opportunity to speak to you from the heart. Good wishes and Godspeed, and thank you for this opportunity.
Pi Alpha is the National Honor Society. First of all, thank you, Dr. Wright. Thank you. Pi Alpha is the National Honor Society for the promotion and recognition of physician assistants. Membership denotes the inductees' significant academic achievement and honors their leadership and professionalism. The motto of Pi Alpha is scholarship, service, leadership, and induction signifies their commitment to lifelong learning and participation in intellectual life. I would like to invite Dr. Stephanie Straight, the program's medical director, to join me as we induct the newest members into the Pi Alpha Honor Society. This year's student inductees include Mary Catherine Jolly, Christopher Colley, Catherine Kappen, Anna King, and Gabrielle Swaysgood. The PA program has indeed been fortunate to have many talented and hardworking participants who support our mission and vision, including our faculty, staff, students, preceptors, alumni, and administrators. Today, we have the opportunity to recognize some especially stellar individuals. Our first award is the Outstanding Preceptor Award. This award recognizes the PA preceptor who has consistently demonstrated a commitment to professionalism and excellence in the clinical education of PA students, as both a mentor and a teacher. Nominations from the students included the following comments. She is an exceptional preceptor who exemplifies compassion, professionalism, and dedication to education. From my first day in clinic, she promoted a welcoming environment that encouraged growth and confidence. She is deeply committed to her patients, modeling empathetic care and thoughtful education. Equally passionate about teaching, she consistently shared clinical pearls, promoted autonomy, and created a supportive learning environment. Her ability to balance outstanding patient care with intentional mentorship makes her highly deserving of the Preceptor of the Year award. The class of 2026 has selected Allison